Morning, afternoon, or evening, everyone online. My name is Wendy Q. I am the Senior Coordinator for Protection from Sexual Exploitation and Abuse and Sexual Harassment in the Interagency Standing Committee Secretariat in the Office for the Coordination of Humanitarian Affairs in the United Nations. Welcome. We are in room H417 in the Palais des Nations, if anyone is in Geneva, wants to join us in person. And if not, welcome to the more than 100 people online to this Interagency Standing Committee briefing on strengthening country-level capacity for protection from sexual exploitation and abuse. And we're going to also highlight the launch, in a way, the soft launch of the Sexual Exploitation and Abuse Risk Overview. So today, online with us, my featured speakers, perhaps my featured speakers could turn on their cameras. We have Anne-Marie Connor, who is a special advisor to the World Vision International President as IASC champion on PSEA and sexual harassment. Craig Williams, who's a humanitarian consultant and the co-founder of the Index for Risk Management InfoRM initiative, which is the basis methodology for the SEA risk overview. I see Carmen Maria de Carmen Rodriguez, who is the IASC PSEA risk consultant with UNICEF, and Marta Augusti, who joins us from Jerusalem as a PSEA coordinator from the Office of Palestinian Territories. So I'm just going to give you a brief overview, a reminder that the IASC has a new 5-year vision and strategy that is based upon a 10-year review of our collective work to strengthen protection from sexual exploitation, abuse, and sexual harassment. A reminder that when we commissioned the external review to try to understand better where more efforts are needed. And some of the conclusions were that we needed more sustained investments into collective actions, and we needed a way to measure our impact in investing in these collective actions. So that's why we have this 5-year strategy with some ambitious targets and clear indicators and benchmarks for us to measure how we're doing. And just a reminder that we're going to need the participation of the collective humanitarian community in order to achieve some of these ambitious targets, and that means some of you online, many of you online, in fact. And it's also a reminder that we've seen, unfortunately, all too often that this is a type of change that will require our continuous and sustained investment. We're seeking to achieve against 3 commitments. So the first one is to globally operationalize a victim and survivor-centered approach. The second commitment is to promote lasting change in organizational culture. And the third is really supporting country capacity for PSEA. And so those are broken down into other specific projects and activities. And Anne-Marie will speak to us shortly on how the champion is supporting our strategy. But our second commitment on behavior change is something that, as we've seen, unfortunately, in today's news, that even some presidents engage in behavior that would get you fired at the UN. So it's something that we need to continue to work on. With that, I didn't hear any laughter in the room, unfortunately. Thank you. I'm going to start with by introducing Anne-Marie Connor, and I'll introduce the other speakers right before they speak. Anne-Marie is, as I mentioned earlier, the special advisor to the World Vision International President, Mr. Andrew Morley, who is our IASC champion since the beginning of 2022. Anne-Marie was most recently the National Director for World Vision in the Democratic Republic of Congo, and throughout her more than 15-year humanitarian career, she's held leadership roles in emergency management and coordination, strategy development, and execution in highly complex and conflict-affected countries. Anne-Marie, welcome. Can you please tell us how the championship helps support the IASC strategy? It's also one of the first times that an international NGO has held the championship since the first champion many years ago. Can you reflect on some of the successes and challenges of the championship so far? Over to you.
Thank you, Wendy, and good morning, good afternoon, colleagues. As Wendy has said, the IASC PSEA vision and strategy endorsed by the IASC principles in May 2022, coupled with the championship priorities, constitute the IASC's response to an IASC external review of the previous 10 years of IASC efforts to confront this challenge, which was commissioned by the previous champion UNFPA, and we're thankful to them for that information. As champion, following extensive consultation in late 2021, 3 priorities to support the achievement of the strategy were chosen, and I'll give you a quick update on where we are with those priorities. The first is around defining a survivor-centered approach. One of the findings of the IASC external review related to confusion around what constitutes a victim survivor-centered approach, and more particularly, what are the agency and individual leader obligations to survivors of sexual exploitation, abuse, and harassment. As champion, we want to remove any excuses for inaction by providing clarity. So as champion, working alongside our co-chair UNHCR, we've worked with a range of stakeholders to draft a concise definition and a set of core principles of a victim survivor-centered approach for all IASC members. The approach seeks to consolidate and harmonize existing definitions and principles while expanding the scope to include sexual harassment. It emphasizes an end-to-end approach from prevention to remedy, using simple, non-technical, plain language to ensure it's accessible to all leaders and managers. So we want this to be a guide for all leaders and managers, and not only our wonderful high-capacity technical staff. The guidance builds on and is consistent, as I said, with relevant previously issued guidance. In particular, I want to draw attention to the 2015 survivor-centered approach for GBV survivors, which was developed by our colleagues at the GBV area of responsibility. Essentially, a victim survivor-centered approach places the rights, wishes, needs, safety, dignity, and well-being of the victim survivor at the center of all preventative and responsive measures concerning sexual exploitation, abuse, and sexual harassment. The draft definition and principles are currently under review by the Technical Advisory Group, which reports to the IASC deputies, and we hope to launch it officially in the coming months. Our second priority, which relates to commitment to, which Wendy highlighted at the beginning of the session, is around culture change. The 2021 external review that I mentioned made several observations around the need for organizational culture change within the IASC and the wider sector. This is something we all agree is needed for sustained reduction in sexual exploitation, abuse, and sexual harassment. In January 2022, SCHR, which is leading the championship, identified a key deliverable, which is having a baseline of perceptions of culture. So understanding from staff, from a variety of different organizations, what are the issues that confront them in their culture. And the way I'm defining culture here is really simply the way we do things around here. So not looking at our strategies and our policies, but really when the rubber hits the road, how do things work in our organization. As humanitarians, we tend to be relatively good at spotting what's wrong in our collective and our individual agency cultures. But what we really want to see here, and the key element of systemizing culture change across the humanitarian ecosystem, is building a cultural narrative where individuals, groups, and structured organizations want to be a part of. There have been challenges in measuring where we are with our culture. And one of those relates, I'll talk briefly about it in a minute, is around transparency and being willing to share information among ourselves around what some of our challenges are. We do hope to be able to share a report with you in the next 3 months, which we hope will provide some more detailed information on what some of the challenges we're facing, and certainly hope we'll be able to speak in a forum like this. Wendy, you asked me about challenges. Very briefly here, 2 things. Interagency work is difficult. The IASC is made up of 18 organizations, UN and NGO consortia. And while we all have the same goal of tackling sexual exploitation and abuse, we all have slightly different ideas and strategies on how to do that. So that's been as an NGO coming into this work, that's been certainly my main challenges is the steep learning curve in understanding the various different agencies. And I mentioned the other challenge is around transparency and really walking the talk around transparencies. Our organizations struggle with concerns around what many call the transparency penalty, a perceived risk that sharing data and challenges in addressing issues of SEA might result in, for example, mistrust among the public or result in donors pulling funds. So that's really one of the issues that we want to be tackling when it comes to culture. Thank you.
Great, thank you so much. Thank you so much, Anne-Marie, for that explanation of your first two priorities. I don't know if you want to touch briefly on one of your the deliverable of your champions that will be translated into supporting capacity, our third commitment, capacity at the country level. Oh, just a reminder for everyone also, we're going to run through the presentations of all the speakers. If you have questions, you can either put them in the Q&A function on the top of your screen. There's a Q&A, or please just hold them and we'll open the floor at the end of all the presentations. Thanks.
Thanks, Wendy. Our third priority is around ensuring that we're resolving practical solutions to problems felt by our field colleagues. Another key challenge that the IASC external review highlighted was the lack of consistent capacity in the highest risk contexts. So essentially that the highest risk context for SEA, and you'll learn more about that from Craig and Carmen in a minute, don't consistently have staff on a sustained basis to tackle these challenges. And the issues that have resulted might be because budgets aren't available or it's short-term funding. So the PSEA cap mechanism, which was agreed by the IASC in late 2022, provides a simple, predictable, and reliable way to ensure that priority interagency PSEA coordinator posts are fully funded and sustainably staffed on a 24-month basis with skilled and experienced staff who have the interagency support they need to do their job. Funding the mechanism has significant multiplier effects as these interagency coordinators support individual agencies and NGO and local organization efforts to reduce sexual exploitation and abuse, and support them to refer reports and respond swiftly and effectively when abuse occurs. The mechanism uses the new SEA risk overview data, which again you'll hear about in a minute, to determine the 15 highest risk contexts. This, what we're calling PSEA cap, is more than a roster. It's recruiting and deploying and also providing succession planning, career development to ensure a strong and growing pool of experienced candidates for this incredibly important role. Ahead of the detailed discussion on CERO, I also wanted to highlight what an important resource this is for SCHR members, which is an NGO consortium of humanitarian agencies, and for World Vision, the organization in which I'm based. Internally, we've looked at the data that CERO has provided, and we've compared it to the context where we have programs. And it's prompted some important internal conversations about where we as an organization need to be putting resources, whether it's human, for example, including full-time safeguarding staff in those higher risk contexts, as well as financial and additional capacity building that's needed in those contexts. So I'll hand it back to Wendy so we can hear more about the CERO. Thank you.
Thanks so much, Anne-Marie. So without further ado, we're going to go into a joint presentation by Craig Williams and Carmen. Hey, Craig. Since you didn't send me a bio, I had to Wikipedia Google you, and you're either an Australian jockey or a conservative British politician, or a humanitarian consultant, a very experienced humanitarian consultant. So Craig Williams, as I mentioned earlier, is one of the founders of the Index for Risk Management. He, as a consultant now, helps humanitarian agencies gather, manage, and analyze data and information to assess the needs of crisis-affected people, manage the distribution of humanitarian assistance, and restore livelihoods in conflicts and natural disasters. He's built and led teams within OCHA and other UN agencies, managed information platforms, and advised senior leaders of the UN on the use of data and information. And Carmen, it's Maria del Carmen Rodriguez is her full name. She's working with UNICEF as part of this joint project between UNICEF and OCHA for the Interagency Standing Committee as a risk consultant. So Carmen has contributed to developing the monitoring tools, which she'll be presenting today as well, both the SEA risk index and risk overview and the mapping exercise. And she is a gender-based violence specialist with more than 18 years of experience in humanitarian and development settings such as the Palestine territories, Sudan, Ethiopia, Nicaragua, Vietnam, and Cambodia. And she's a particular interest in research and creating evidence-based models that contribute to effective ways to prevent and respond to violence against women and children. So we're very keen to hear from both of you on explaining what is the SEA risk overview, how it connects the IASC strategy to field level work, and also if you can help us engage better in understanding how it can help some of our practitioners and partners that are online. We heard already from Anne-Marie about how the Steering Committee for Humanitarian Response is able to use some of the data. So over to you. I think, Craig, you're kicking us off. Is that correct?
That's correct. Thanks, Wendy, and hi, everyone. So the SEA risk overview is a composite index that aims to help identify countries with ongoing humanitarian emergencies that are at heightened risk of SEA and require additional resources and action. For anyone not familiar with composite indices, one of the best known ones is the Humanitarian Development Index, or the HDI. HDI uses just 4 indicators on education, health, and living standards to give a global baseline of human development. And there are a growing number of composite indices in the humanitarian field, including 2 from the Index for Risk Management, or INFORM project, that aim to measure the risk of crises occurring and the severity of existing crises. So composite indices aren't intended to drive decision-making directly, but they can be a useful tool. In this case, for understanding the factors that drive risk, in creating a shared evidence base, in identifying issues that need further exploration, and also tracking changes over time. Next slide, please. Oh, thanks. So CERO is a composite index that was developed to help understand the drivers of SEA risk. And we see this tool as important because we don't have a clear understanding of SEA prevalence. We know it's underreported, but because measuring SEA directly is still so challenging, what CERO aims to do is instead measure many of the factors that are associated with increased prevalence, and then identify through that where we should focus further attention and resources. Next slide, please. So CERO provides a data-driven analysis of SEA risk factors. It covers countries that have international humanitarian response operations. So at the moment, that includes 33 countries in the version that we're presenting today. It's primarily aimed at global actors. So we anticipate IASC members and donors incorporating the analysis into their planning and decision-making, as we've already heard from Anne-Marie. And we also hope it'll be useful for national actors, especially PSEA coordinators and networks, and really anyone who seeks to better understand the SEA risks at the national level. The index is easy to download and use, as I'll show you shortly. It has a transparent methodology, and almost all of the underlying data are also made available as part of the index. And the aim is to review and update CRO at least once a year to help us improve the methodology over time, and also to allow us to measure and monitor risk over time. Next slide, please. So this is the analytical framework. It's designed around 16 different components, which are listed along the bottom. And each of these components represents a factor associated with either increasing or reducing the risk of SEA. The 16 components are then grouped into higher level categories and dimensions. So the first dimension is called the enabling environment, and it reflects factors that exist in every country, whether there's a humanitarian response or not, such as national laws, policies, underlying societal norms and local practices, really anything that can create an enabling environment for perpetrators of SEA. The second dimension is the humanitarian context, and these components reflect the introduction of one or more crises into a country, such as a conflict or a natural disaster. And it measures the increased risk that comes from a crisis, such as growing needs and deteriorating security. The third dimension is the operational context. This reflects the design and capacity of the response operation, so including things like awareness of PSEA among humanitarian workers and institutions, the types of assistance that are being provided, how they're being delivered, how they're being monitored, as well as the impact of capacity and resource gaps. And then the fourth and final dimension is called the protective environment. And this reflects specific measures that are put in place to reduce, identify, and address incidents of SEA, such as PSEA coordinators and networks, reporting mechanisms, or survivor assistance. And the analytical framework uses a relatively large number of components, say compared to the 4 that HDI use, but we've done this by design because we believe that understanding SEA risk is still evolving, and we hope that the framework itself can contribute to the ongoing discussion around the various different factors that contribute to it. So now if technology plays along, I will briefly show you the index itself. Here we go. The index is publicly available through the IASC PSE website, and we'll insert the link into the chat. And it's provided as an Excel spreadsheet, so it's easy to use and download the data. So on the main dashboard, you'll see the 33 countries that are covered in the current version, and a score for each of the components. The score uses a 0 to 10 scale, where 0 is the lowest risk and 10 is the highest. And this common scale makes it easy to compare scores between countries and to track changes over time. You can use common Excel features to sort, filter, and view any of the data, or you can export it to other systems. The spreadsheet is self-contained, so nearly all of the underlying data is available, so you can view it directly in the model or export it to your own systems. And we won't go into any of the detail because we don't have the time, but as you'll see, if I do a quick sort of the risk, the highest ranked countries are not surprisingly the largest humanitarian operations. And that's for the simple fact that the large operations mean large numbers of humanitarian staff in more locations with more opportunities to interact with people who are in greater need. But the way we've designed the model is to let you explore the data in a lot more detail. So, for example, if we sort by enabling environment, you can see some of the countries that are at a higher risk because of a prevalence of gender-based violence or weak protective laws. Under the humanitarian context, you can see countries that are at higher risk because of major challenges with issues like access or security. Under the operational context, you can see that many of the highest risk countries have large components of the response for transactional goods, such as cash and food, or perhaps face funding shortfalls that could weaken oversight. And then lastly, under the protective environment, this one's particularly interesting because you see a lot of countries that are low risk overall, but are relatively high risk in this area, perhaps because they lack dedicated PSEA capacity or have limited resourcing for protective measures. So obviously this is just scratching the surface. So we hope you'll download the index and explore the data for yourselves and share your feedback with us. And with that, I'll hand over Carmen to wrap up this the second part of the section.
Thank you very much, Craig, and thank you, Wendy, for the introductions. Good morning, good afternoon, everyone. If we can go back to the presentation, there are 2 slides before this one. Thank you, Wendy, for sharing the link to the index. You can download there. Not only the spreadsheet that Craig has just presented, but if you want to explore more about how the index has been created and all the factors that are assessed, you can go through the concept or methodology and then read through what are the most frequent asked questions. And the final slide is for me to explain how we believe zero is useful, other than the use that Anne-Marie already has presented. That is obviously to help direct PSEA resources towards operations with high risk, and then it is obviously done through the creation of the PSEA cap. Other uses of the index have been explored to support analysis, planning, and decision making, as well as to help increase understanding of what are the drivers of SCA risk at global level. At country level, some operations are already considering the use of the analytical framework to approach their national risk assessment. So it's important to note that the tool has been released as a beta version initially for 1 year period. And then this period will allow us to socialize and test the model under real world conditions, with the aim to update and fully and revise the index by the end of this year, 2023. So we really encourage you to visit the site, download the index, and explore the data and share your feedback with us, because your inputs will be extremely useful for this purpose. We will continue exploring opportunities of the tool in strengthening PSEA monitoring mechanisms, and we want to continue supporting countries to apply the analytical framework to their risk analysis, and even adapt the methodology for subnational risk assessments if countries believe it is needed. So with that, I will move on to the other 2 tools that we want to present today. These are 2 monitoring tools that UNICEF has developed on behalf of the IASC. And I want to show you how also these tools are interconnected to the SCA risk index. Next slide. As Anne-Marie presented, and Wendy as well, the IASC vision and strategy outlines how important it is to adapt the evidence-based approach and strengthen results tracking. So the 3 tools that we are presenting today are framed under these commitments and help deliver on the objectives to support capacities and accelerate on PSEA progress. And in the next slide, I want to briefly contextualize and explain to you how these tools are important to support accelerating on PSEA progress. So as you can see, the zero index, the mapping exercise, and the dashboard are in the gray arrows down in the lower part of the chart. And these are tools created to help monitoring risks and help monitor as well the results achieved. So the information produced through these tools tracks and visualize progress, as well as helps identifying gaps and then better prepare for mitigation actions for SEA elimination and reduction. So next slide, please. This is a sneak peek to the dashboard, and then the dashboard is sitting within the IASC PSEA website. I will insert the links shortly after the presentation in the chat box. So in 2020, UNICEF developed and launched the website and the global dashboard with the aim to strengthening global IASC community of practice on PSEA and then promote good practices through the knowledge management and establish a results-based approach to PSEA. So the website is not only a knowledge sharing platform with more than 500 resources in multiple languages, but also serves as the broader to the broader community of PSEA practitioners. And then so the dashboard is the only global platform where donors, UNCTs, HCTs, and humanitarian countries, the humanitarian community, at large, can have access to key information on countries' progress on PSEA. So the dashboard is updated annually with data coming from responses on the mapping exercise. And as you can see, this is a sample in this slide. The global dashboard presents data on key indicators and allows a comparative analysis through the years. And we have data since 2019. The global dashboard is also accompanied by individual country pages where you can find information and resources produced by individual countries. And next slide, please. So this is the final tool that helps collect and gather data to be presented on the global dashboard. And from 2022, the mapping exercise is based on the revised core indicators, which are a selection of most relevant measures to be tracked over time. So for the first time in 2022, the exercise has provided a standardized set of methods of calculations with clear definitions on indicators that are presented in a guidance note. And again, I will put the link on the chat box so you can download this guidance note and take a look. So the exercise was conducted during the first quarter of 2023, and we got responses from 28 countries with humanitarian operations. To assist on the compilation of data, the mapping was launched together with this package of resources that you can see there, and you can download from the website. And additionally, there was a global training through 4 webinars to increase the knowledge and the skills of the PSEA coordinators, UNCT, HCT focal points, and network members that were about to collect this data and use the indicators. So a total of 76 practitioners participated in the webinars. It is also important to mention that from 2022, indicators tracked through the mapping are also feeding the zero index. So both tools are interconnected and help each other in bringing a larger set of information on SEA risk reduction. So with this, I will put an end to this, I'm sorry, rather maybe long presentation, but there were too many tools to present, and happy to get any questions. In the next slide, you can find my contact details if you want to contact me later on, and also the contact details of Katie Waplo, who is the UNICEF lead on PSEA. Thank you very much.
Thanks a lot, Carmen. We'll put your contact details and Craig's contact details in the chat. And there are some technical questions both in the Q&A and in the chat, so maybe if my presenters can address those others, we'll come back to them at the end otherwise. But I wanted to look at the field application of some of these tools, and I wanted to introduce Marta Agosti, who is the PSEA coordinator for occupied Palestinian territories. Marta has a PhD, a doctorate in social anthropology, and she has worked with survivors of sexual violence since 2007. Her research has focused on gender, body politics, and citizenship, and she's done a thesis on sexual violence in Egypt. She's been in the Palestinian territories for several years now and is going to speak to her experience there as interagency PSEA coordinator. Marta, how do you see this mapping exercise and other global initiatives helping you, and vice versa? How are some of what your challenges and practices informing the development of our global guidance? And I'm also keen to hear from your reactions to Anne-Marie's presentation, if you see any particular linkages between the championship priorities and what you're doing in the field. Over to you, Marta.
Thank you, Wendy. Thank you very much. So I will try to explore the linkages from what has happened in Palestine, and also from the perspective of what it means, to have a survival center approach when, we engage with the PSEA agenda. With two main messages. The first one is that without the mapping, it's very difficult to have a frame that will enable a discussion at the country level. So it's really helpful to have something in paper that will help, that will help, there's someone with the camera on. That will help, with understanding, particularly the dialogue with senior leadership on what it is expected from us and how, the theory applies at the country level. Similarly, with the championship, each of these champions, I've been working in Palestine since 2020, so it's been 3 years now. So each champion has brought up a different angle or has helped to move, the dialogue at the global level. I think the challenges that we have is the dialogue. How do we establish the dialogue between the field office and the global level? Because the priorities might not be the same and we don't see the same things. And I wanted to quickly walk you through the results in Palestine of the mapping exercise that we did with Carmen and Craig. Okay, so can we move to the next slide, please? So the PSEA network in Palestine is very well established. We are one of the few countries that we have had sustained funding, and this has been essential to actually build a trust relationship with the communities and with senior leadership, and that has really enabled us to show progress. Okay, so we have 76 signatories of the standard operating procedures that participate in our community complaint mechanism, and we have another 24 that relate to us in a more informal way. And this is a very important aspect, like being organic enough to create, a movement at the country level where people feel that they can participate, and if they are not yet meeting the standards, they can still benefit from the network. So when they are ready, they can sign the standard operating procedures. So we have done 2 monitoring exercises. We do one in June and one in January, aligned with the Interagency Standing Committee. So it helped us to track, progress and to be able to aggregate numbers. And we had 29 responses in the 2 cycles that we have done. Next slide, please. So, for instance, one of the challenges that we have is to really understand how many humanitarian workers we have. So the potential outreach of the network is 253 organizations. And only with 29 reporting, we already have around 17,000 employees. Palestine is a huge operation, particularly because we have the presence of UNRWA. So it was difficult to understand what is the community that we are talking about. Can we go forward? Yeah, so we saw as well, what is the level of training that we have, which was not bad. But in here, the mapping also helped us to understand the different perceptions of the partners. So self-reported, they said, that around 1 million people had access to reporting channels. But through the multi-sectorial needs assessment, we understood that the community perception of those channels is that they will not use it, or they don't know that they exist. So it helped the mapping exercise with other tools help us again, to move on the conversation at the country level. Okay, can we move next slide, please? So something that is clear is that, and maybe this is part of the dialogue that we want to have with the global level, is that PSEA has to be much more comprehensive. And this is maybe the message, that we need to send out. So with the effort that you see in the screen, okay, that where we have around 1,200 project sites with IASC materials, where we have, around 800,000 people that have received PSEA messages, and where we have around 500 people that have been consulted on preferred ways to report PSEA, we only have 16 claims. So can we move to the next slide? This has to do a lot with how do we approach collective systems. So it's not only about meeting my institutional accountability, it's also about how do we understand what is happening in the communities, what is important to them, and when we approach them with such a big subject that is sexual exploitation and abuse, how this translates to them. So for them, it does happen. The prevalence of sexual violence is way bigger than SCA. So how can we respond to their needs as well? So just again, these 16 claims that we received last year, which is already, we are increasing in the number of claims, which I have that as a good sign. To reach to that, our main strategic helpline that provides MHPSS services and first aid counseling receive around 20,000, provided around 20,000 counseling sessions, okay, and had around 7,000 contacts with cases of SGBV, and 215 cases had to be referred to in-person services. So this is the context we operate when we are talking about a humanitarian situation where SGBV is endemic. Can we move to the next slide? So how do we link senior leadership, what is happening at the global level, and how do we find momentum into that to actually engage with communities for behavioral change in a manner that is effective and responsive to their needs. So in Palestine, we have focused on being able to incrementally engage with communities at the same time that we are able to address all the cases that came through the channel, not only SCA cases. And that was a big challenge, okay? Next slide, please. I only have 5 minutes, so I'm really running you through this very quickly, okay? But how did we get here was because we have a network that was properly staffed and reporting to the humanitarian coordinator. We have very well mainstreaming of PSEA in the HRP and the clusters, and it's now we are moving the monitoring to the 5Ws. This is a very technical thing, but for those that have worked in humanitarian settings before, it's also a very good achievement to be able to analyze trends related to protection. We have also mainstream PSEA within the emergency responses. So now when we do joint post-shock assessments, we have one person doing safeguarding messages, and we target the population that has been on a escalation of conflict event with the mobile messages. We work a lot with the community. So for instance, we have the newsletter that we've been producing for now a year and a half that really informs, all these vast 22,000 employees that we believe we have. We also have a focal point for the victims, the Office of the Victims' Rights, and we have a strengthened partnership with key, interlocutors to be able to provide capacity building for all these organizations. And we have a very strong peer-to-peer program. Okay, next slide, please. So, well, this is our annual working plan. The way you can move to the next one. The way we divide it. Next slide, please. The way we divided our annual working plan was that every of these outcomes that you see is divided between network responsibilities and partners responsibilities. So now we have started asking partners to develop their own annual working plan so we can organize the technical assistance that they will need. So with the idea that we will increase the reporting towards the Interagency Standing Committee. So we've been aligning all the exercises with the idea that the data we produce will influence the dialogue at the global level. So big challenges are funding. So right now we have established a quite solid mechanism, but we only have funding so far until October. And another conversation that, for instance, is not very well reflected at the global level that we wish to needs to happen is that we need to strengthen implementing partners' capacities, because a lot of the times what we do is to implement through partners, but we cannot delegate the accountability for PSEA. So back to the two questions, Wendy, it is very important to maintain this dialogue. And, for us, without the global discussion, we will not have the frame that will guide the leadership. And without the mapping, we wouldn't have, the evidence that we need to move on. Thank you.
Thanks so much, Marta. Really a lot of work happening in a challenging context. There's been a lot of questions, both in the chat and in the Q&A, about some of the ways that the ICA risk overview is brought together and, why which countries were selected. So I don't know if Craig or Carmen, you want to just address those kind of globally, and then we'll come back and see if there are any other questions. I know that you've written the answers, Craig, but maybe just a quick.
Sure. Yeah, I think some of the main issues that came out were about the country selection. So at the moment, the model covers countries that have an HRP, flash appeal, or similar instrument. At the moment, it does not extend to refugee hosting countries under RRPs. That's the coverage. And there are a couple of questions about how the model is updated. So we aim for at least an update once a year, where we'll also review the methodology. But there is an ability to do an update mid-year, for example, if there's a new emergency that we want to add. Carmen, anything else in the comments you want to add?
Yeah, trying to respond also to the question on how did we build and how did we select the risk factors. So we went through a desk review that was based on literature review and also interviews with more than 30 experts in both in the field and the global level, and we developed a list of more than 240 potential risk factors that we reviewed against a list of 5 quality criteria. at the beginning, and then these criteria were 6. So we kept on reducing the list and selecting the factors and the potential indicators that will better match with these quality criteria in terms of coverage, quality of the data, frequency for the update of the data, etc. This is how we did it. And you can find more information about these indicators and how the index was built under this methodology and concept document that you can find online.
Great, thanks. And because you did the wrong button. Because it is under the auspices of the Interagency Standing Committee, we have been focusing mainly on humanitarian contexts, and the criteria, as Craig mentioned, was those contexts that do have a humanitarian appeal of different sorts. And similarly, our dashboard is mirroring, in a way, those countries that have humanitarian coordinators and humanitarian response plans. But we are sensitive to places that have emergency needs and changes in their context, and hence, for example, Turkey, following the earthquake, there is now a humanitarian coordinator, and we might be looking at some of the impacts of the earthquake there. I wanted to give my panelists, before we close, a chance to leave us with some key messages. So I'm going to go around backwards and ask if there's any parting thoughts or key messages that you wanted to share with us. There's still some more questions on the SCA risk overview in the chat, and so I will let Carmen and Craig answer those. But going back, Marcia, is there something else you'd like to add? I know you felt time pressed at the end. Maybe just a 1-minute takeaway for us.
Yeah, thank you. I'm thinking, just maybe from the community perspective, they don't distinguish WFP from UNICEF, from GVC, or Save the Children. It's too complex. So at the country level, if we want to have a survival center approach friendly to the communities, they need to see one interface, not hundreds. And that's why collective efforts at the country level and the global level are so important. And we sometimes see that maybe, global level institutions are very protective, and that doesn't help. Thank you.
Thanks, that's an important reminder. Important reminder from your side, Marta, thank you. And I just want to recognize that a lot of the work that we've been trying to advance at the IASC is also thanks to initiatives that are sponsored by our members and then made available to the wider community. So we do recognize that UNICEF, UNFPA, IOM, WFP have all contributed to our training materials, to developing risk assessments, to developing other methodology. And we're learning also a lot of good practice from CHS Alliance and some NGO partners. Again, any final thoughts from your side? I'm going to go to Carmen next.
Thank you very much. And taking over from what just Marta said, like how important is the collective action, I would add on these regards, bringing visibility and measuring and showing how this collective action is progressing is important. Hence, all the tools that we have presented today, that they are useful to on the one hand, inform the donors, the community in a context with very limited resources. It is very important that these progress are well presented, and also identify what are the areas that require this additional support, right, to strengthen the capacity, and based on evidence, request the support needed, the funds needed. Marta mentioned that this is one of their main challenge. So based on this data, based on this evidence, what are these areas that or these capacities that needs to be strengthened. So yeah, that's my final message. Thank you.
Thanks, Carmen. Craig, your 2 cents for us?
Yeah, I think mine would be, there's a famous quote that all models are wrong, but some are useful. And ultimately what we're aiming to do here is to create a tool in Zero that's going to be useful. So the reason we launched it as a beta model this year is to give the community a chance to play around with it and give us feedback on how to make this a genuinely useful tool for you all. So please do download it, look through the data and the methodology, and come back to us with any suggestions you have on how we can make this more useful. Thanks.
Thanks a lot, Craig. And I'm just going to add to that little plug is that we are hoping to be able to extend and deepen the SEA risk overview, but we are looking for resources to do that. Over to you, Anne-Marie, for some final messages from the champion.
Thanks, Wendy. My message is that this work and culture change takes time. We are all increasingly impatient to move the needle on sexual exploitation, abuse, and harassment. And I would encourage each one of us to think about what we can do within our own organizations as leaders to move the culture in our organizations. And one of those things is to ensure that we're informing our staff and communities about reporting mechanisms. And as Marta said, that we make those reporting mechanisms simple, easy to use, and that we're responding robustly. And that's something that as champion we're encouraged to support and know that there's a lot of movement on this as well. So thanks so much, Wendy, for the opportunity to speak to this group.
Thanks so much, and I want to thank all of you for spending this time with us online. You have contacts to reach us should you have any questions, or I do encourage you to explore the information that was presented here. We will make the slides and presentation available. I wanted to recognize the people behind the scenes, if our camera in the meeting room had worked. I have Menti from the IASC Secretariat and Nina from the IASC Secretariat, who were doing all the heavy lifting behind the scenes. Again, we really rely on all of your engagement and joining us to realize our vision for protecting those that we are seeking to help from sexual exploitation and abuse, and ensuring that we have a working environment where also humanitarian workers are empowered and free from concerns about sexual harassment. So we do get a lot of energy from your ideas and your engagement. Please do reach out to us and give us feedback both on this briefing and on any of the materials presented today. And thank you for the hands. See you soon online.